Okay, well, good morning and welcome to the first of many celebrations of Safety Net Clinic Week this week. My name is Lynn Jones. I'm the Executive Director of the Colorado Association of Family Medicine Residency Programs, for whom most of those operate as Safety Net clinics. So we're proud to be here with our partners, the school-based health clinics and Denver Health and the Colorado Rural Health Center, and looking forward to an active week letting everybody know what's happening. So we do have a proclamation by the governor, and I will read that for us now. Whereas there are a variety of valuable safety net providers in the state, 49 community safety net clinics, 54 federally qualified rural health clinics, 69 rural-based health centers, 10 family medicine residencies, including 4 rural training tracks, and 12 rural rotation sites. Whereas these care settings were established by civic-minded individuals, healthcare professionals and systems, and community organizations who recognize that there are many individuals, children, and families in need of access to healthcare services in rural and underserved areas of Colorado, and whereas people who are uninsured face significant hardships, such as increasing numbers of uninsured people across Colorado, uninsured individuals are 3 times more likely to get sick and not seek needed care. Uninsured individuals are more likely to need hospital emergency care and die from an illness than an insured individual, and 60% of bankruptcies were caused by medical bills before the COVID-19 pandemic. Whereas Colorado's school-based health centers provide primary health care, behavioral health care, and many more services without barriers of transportation, cost, or insurance. Whereas school-based health centers are proven to be powerful tools for achieving health equity and are intentionally established in communities that have been experiencing harm or discrimination. Whereas school-based health centers have demonstrated their ability to increase access to health care, improve academic achievement, reduce emergency room use, lower medical aid costs, and increase the use of sensitive services like behavioral health services. Whereas Colorado's Commission on Family Medicine has for over 40 years addressed documented needs in the state for well-trained family physicians, particularly in rural and underserved areas, as well as the need to prepare family physicians for advanced primary care, characterized by team-based, integrated, and patient-centered care. Whereas Colorado's Commission on Family Medicine promotes high-quality health care for all Coloradans by enhancing access to primary care, including rural and underserved communities, through the training of exceptional family physicians. And whereas Colorado's Commission on Family Medicine cultivates and develops a highly qualified family physician workforce in Colorado to appropriately meet the needs of the population, including rural and underserved communities, through recruitment, education, advocacy, and resource sharing. Whereas Colorado's Commission on Family Medicine requires that all family medicine residents complete a 1-month rotation in a rural location as part of their training. The intent of this experience is to increase a resident's propensity to select a rural site for practice upon graduation. Whereas 47 of Colorado's 64 counties are considered rural or frontier, spanning over 75% of our state's landmass, most of which is considered a health professional shortage area, resulting in significantly less access to care and poorer health outcomes. And whereas rural health clinics provide essential health care treatment and preventive services to vulnerable populations in rural communities throughout our state. And whereas rural health clinics and safety net clinics often lack sufficient funding, workforce, and technical resources, but are creating innovative solutions to delivering patient-centered, high-quality care in an efficient and effective manner. And whereas Colorado Safety Net clinics are safety net providers primarily serving Coloradans who are uninsured, underinsured, or insured through public programs like Medicaid, CHP+, and Medicare. And whereas Colorado Safety Net clinics receive very little, if any, government funding, instead they rely on complex and vulnerable funding streams. And whereas we express our appreciation and gratitude to these clinics and their workers and physicians and care providers who dedicate their time, energy, and resources to serving our communities. Therefore, I, Jared Polis, Governor of the State of Colorado, do hereby proclaim August 22nd through 28th, 2021 as Safety Net Clinic Week in the state of Colorado. Thank you very much. Thank you for taking time to hear that out. And we'd like to hear from a couple people today. in terms of how the family medicine residency programs are helping to both get through the pandemic and also meet the needs of those most marginalized communities. And we're happy to have Michael Benavides, who works here at Denver Health, both on the faculty for the residency track and also as a primary care provider. So Michael, thank you. I'm going to help you do that.
Sure.
Is that okay?
So, my name is Michael Benavides. I'm the Assistant Medical Director of the Lowry Clinic and Director of Recruitment for the University of Colorado Family Medicine Residency. I came to Denver Health as a resident in 2000. I was in the 3rd class of the Denver Health track, and at that time there were only 2 residents in each of the classes. I was able to see how much the residency has grown. A few years ago we went up to 4 residents, and just this last year we graduated our first class of 5 residents from the Denver Health track. I was drawn to Denver Health as I would be able to work with underserved patients and working at a federally qualified health center. I was excited also to improve my Spanish. I graduated from the residency in 2003 and took a job where I worked half-time here at Lowry and the other half at the Hospice of Metro Denver, which is now the Denver Hospice. When I came out of residency, I was able to do it all. I was in the OB call pool and delivered babies at Denver Health. I was seeing patients here at the clinic and also working at the inpatient hospice. Working in family medicine, I've had the opportunity to see a wide variety of patients, and here at Lowry, I get to see patients from many different cultures and backgrounds. I enjoyed working with the residency and being able to teach the residents. I have so many of the residents that I have taught join us here at Denver Health after they've graduated. I've seen them grow from being an intern to being my colleague. I also have had many of our residents go out into Colorado, working in Denver and other rural locations. There have been many who have left the state, who have gone off to do fellowships, but many of them come back to Colorado. I'm grateful for the opportunity to teach the future family doctors, as I know they are doing great things for our communities.
Thank you, Michael. And we're also honored today to have one of our residents here to say a few words about his experience at Denver Health. So Danny, would you like to?
Yeah. Perfect. All right, my name is Danny Wells Prado. I'm a 3rd-year family medicine resident here at the Denver Health, University of Colorado Denver Health track. And I was really excited to join this program because of my dedication to serving underserved communities in Colorado and throughout the world. I am a National Health Service Corps scholar, and so beginning in medical school, I was committed to working in a primary care specialty, working with underprivileged populations, and coming out of medical school, Denver Health was the perfect choice because it had a great residency program with support from the university, and also just all of the benefits that working in a safety net clinic provides. And that was one of the major reasons I wanted to come here and train specifically in a safety net clinic like Denver Health. And it has been such a great experience because with our residency program, we have such a learning-focused environment, and we're able to provide a whole spectrum of care to all the patients here, going from newborn care, seeing babies right after they're born, watching them grow up, talking about family planning with patients, helping to manage chronic diseases like heart failure, diabetes, kidney disease. And really at a safety net hospital, we do it all because sometimes we really have to, because a lot of our patients just don't have the resources or the coverage with health insurance to go to other specialties and places. And so a lot of that privilege falls on us to take care of them as a whole person, knowing their families, following them throughout their life. And that's been a really special experience that you really don't get at many other clinics. And so that's one of the great reasons why residents are so important to safety net clinics and providing this care. And a lot of times too, we stay in safety net clinics after we graduate. I plan to stay in Denver, hopefully, and work in one of the safety net clinics here in the metro area and just continue my dedication and training and service to communities who do not have access to healthcare like others do. And yeah, that is one of the reasons I love working here and why we're so important part of this clinic and safety net clinics in general. Thank you.
Thanks, Danny. I don't have too much more to say other than the residency programs in Colorado were put in place to help to assure access to primary care in rural and underserved areas. And regardless, Danny spoke very eloquently of all the various needs of patients, and especially in marginalized communities and those who have a shortage of primary care providers. And we do all act as safety net clinics. We all serve the underserved in our communities, and so about 100 residents that graduate from training every year, about 2/3 of them wind up practicing in Colorado somewhere. And so we're very glad to be able to help contribute to meeting the primary care needs of the people of Colorado. So thank you very much.